I'd been here for 6 years and had worked clinically for 6 years, and I thought I want to do something else to see if I can better benefit the community that I live and work in. And for me, research was that next step. I've been able to undertake some PhD research alongside my clinical role.
So I am a physio helping run a study called PACE Rural. This study links in a specialist musculoskeletal physio earlier in with our chronic pain patients. I thought that, it was a really interesting and potentially exciting opportunity to reach into this research world. I definitely had an interest in, but within kind of staying within WACS for that.
WACS clinicians are innovators. They are constantly needing to adapt their practice to be able to provide the best healthcare that they can to the people in their communities, and innovation is the underpinnings of research.
WA Country Health Service is the largest country health service in Australia and one of the largest in the world. From nursing posts in remote parts of the state to busy regional hospitals, our mission is to deliver and advance high-quality care for country WA communities as close to home as possible. This is challenging when you consider we deliver health services to a population of about 560,000 people into more than 100 hospitals and health services spread across 2.5 million square kilometres. By supporting our regional workforce to lead research and innovation, we're addressing the unique needs of our regions and encouraging a culture of curiosity and collaboration. Over the past 20 years, rapidly changing technology has created new opportunities to think innovatively about how we deliver healthcare to regional and remote communities, with a focus on embedding research and innovation into everything we do. WA Country Health Service is focused on priority topics for Aboriginal communities and want to involve and co-design with them.
So I'm really proud to be a part of the new research within WACS. So we're working alongside Menzies School of Research. They have trained the Aboriginal staff how to use a Neuroscan.
The Neuroscan involves one of this device. It's a handheld ultrasound that we can take and carry out in the community. We just connect it to an iPad. We upload it onto the system that we then send to a cardiologist off-site, and then they review it and get back to us. The skills that we now have to use this device, it broadened our scope of practice, and I feel proud about it. So this is really good and safe and culturally safe, especially for us Aboriginal people.
Clinical yarning is a patient-centred framework to improve communication. It's about building that rapport with the patient and understanding that obviously, the clinical aspect is really important, but there is a big emphasis on building that rapport and trust with Aboriginal people. WACS have been working with the clinical yarning team in terms of their research project and delivering training and an e-learning package for about 3 years now. During that time, there's been, I think, over 270 clinicians trained across the region.
Incorporating virtual technology, the new Clinical Trials Centre supports staff at our country sites to lead research and innovation.
So what happens with teletrials is that we're investing money into regional areas so that we can employ more staff. We can educate them on how to conduct clinical trials and research. For staff, it means that they get to use cutting-edge treatment and interventions, so that's very exciting for them. And for patients, it's exciting for them to get access to these new treatments and drugs.
The benefits for our patients are that it really does give us an opportunity to provide an equitable platform for them, so they can have access to cutting-edge kind of research processes in a local setting. Being in the teletrials program gives us another avenue where we can kind of work with the Perth team, who is gold standard. At the end of the day, having gold standard care for these patients is my only goal.
WA Country Health Service is considered a world leader in virtual emergency care through the Command Centre, offering 24/7 support to our frontline clinicians across country WA.
One of the core principles of the Command Centre is to make sure that patients have equitable access to healthcare wherever they are. We have many specialists that work within the command centre to work alongside the specialist skill set that is already in country areas.
I was very fortunate to get accepted into the Allied Health Novice Researcher program, so based as the first command centre pharmacist. My role was to create a virtual service which we could operate in kind of an innovative, sustainable model.
I think sometimes when you're a researcher you can be a little bit removed from the people on the ground and trying to get your research into practice. Being embedded in the command centre environment is really exciting for me because I'm embedded in that dynamic environment, that nerve centre of country WA.
One of the innovative programs we offer is the award-winning Pitch Your Pilot annual competition. Staff pitch their creative ideas for improving the way we deliver care locally.
With innovation comes creativity and pushing, I guess, the boundaries around how we've always done things. What programs such as Pitch Your Pilot does is provide some confidence that you can be involved as a clinician in maybe bigger research projects.
We are establishing strong partnerships with local, national and international universities, not-for-profit organisations and industry, ensuring our research meets the highest standards for patients and communities.
We are absolutely moving towards WACS driving our own research agenda and leading our own research within the organisation and becoming known as a national and international research leader in the area of rural and remote healthcare.